There is continued anxiety at Ballad Health about the Senate's version of the federal spending bill, even after the system got some very positive news just a few days ago. News Channel 11's Jeff Keeling has been following the proposal's impact on what's called the Medicaid provider tax. Tennessee's been seeking federal approval for an increase in its tax to give a huge boost to Medicaid reimbursement for hospital care. Jeff, what's the latest on this situation?
Yeah, Casey, well, Ballad CEO Alan Levine said the very latest is bad news. Yesterday afternoon, he posted on X that if something doesn't change, Ballad will have to rethink its commitment to replacing the hospital in Unicoi County that Hurricane Helene destroyed last year. Today, he told me the bill puts all Ballad's rural hospitals at risk. The Senate's version would gut the gains that provider tax was about to bring, and they were really big.
We would get those dollars for this past year, plus it recurs going into this year. So I can't tell you exactly how much the number is. It could be anywhere from $130 to $150 million.
That's money Ballad can use to subsidize money-losing rural hospitals and invest in equipment and buildings. But despite that good news, Levine soon learned the Senate's version of the federal spending bill would erase most of that bump starting in 2028.
We certainly don't want to mislead anybody. If this bill passes with the language that's currently in there as it relates to Medicaid, it will lead to closures and it will lead to the loss of services in some of these communities. There's no question about it.
Making the future of a hospital in Unicoi County unclear. State and federal aid is in the pipeline for an estimated $50 million rebuild. But Levine said now leaders are huddling with state and federal officials
to decide, what is the pathway forward. We don't want to throw away $50 million and then in 2.5 years make a decision because of these cuts that we've got to close some of our hospitals.
Renee Jones represents Unicoi County in the Tennessee House. She says she's been lobbying federal officials against the Senate proposal.
I'm very scared not only for Unicoi County as we need to rebuild our hospital, not only scared for what that means to us, but what that means to our neighboring rural counties.
Jones says even if rural hospitals run at a loss, their presence remains a winner in their communities.
We need that hospital to be here for the future to ensure, not only is it for our health, but it's also an economic driver for this community.
She understands Ballad leaders need to make a wise business decision about the rebuild.
It's not one that I am going to accept lightly. I hope that we can continue to talk to our federal legislators and continue to talk to the state and make sure that we're able to navigate through that and this still can be a reality.
Well, the version that the House passed does not impact that provider tax change. And if the House doesn't pass the Senate version, it will move to a reconciliation process where this matter could come back up for debate.